Just 32% of Black adults in the United States say they would take a COVID-19 vaccine. That's according to the Pew Research Center. On Chicago's South Side, the community isn't just concerned about the vaccine. They are also trying to save a major hospital that's on the verge of shutting down. Mercy Hospital serves the Black community in Chicago and is scheduled to close even with the virus killing Black folks there at an exceptionally high rate. NBC News correspondent Antonia Hylton explains the deep scars in this community and deep distrust of the health system.
Hey, Allison, I'm on the south side of Chicago, and here there is a lot of anxiety around this coming vaccine. Some for reasons due to current events and some because of historical ones. Right behind me is Mercy Hospital. This is a historic hospital that has served poor people and Black people on the south side of Chicago for generations, and it's closing down in the new year. And residents say that is evidence that leaders here do not care about their access to health care or their access to things like vaccines. And then there are the historical issues with this story. And many people here have cited, for example, the Tuskegee syphilis study to me. This is an infamous study from the early 20th century. Black men with syphilis were basically watched by white doctors and allowed to get sicker and sicker with no treatment. And Black families talk about this all the time around the dinner table. And it completely informs their relationship with providers and their decision-making around things like vaccines. Take a listen to some of the conversations I had this week.
I do not believe them because, for one, everything's about money, you know. I feel like the most disadvantaged folks will be left behind, you know. I mean, and who say would they give us the full-fledged vaccine? They might give us a generic version of the vaccine.
The African-American community, we're just not trusting because we do feel like we're the first person that they want to test it on, and we're being experimented on.
You know, I want to point out that what Antoine Miller said there is not true. There is no generic of this vaccine, and generic drugs are just as effective as brand name drugs when they are developed. But I think that it was important to hear what Antoine had to say because it shows you just how deep-seated these fears are. And it's important to note, you know, these are not anti-vaxxers. These are not people who think that vaccines cause autism. They haven't been radicalized online. Their fears come from real events in history. And if you're a public health official figuring out how to address it, you're going to need to acknowledge that.
If enough Americans are going to get the coronavirus vaccine to make it effective, they need to trust it, especially in communities that our healthcare system hasn't properly served in the past and isn't properly serving now. Yahoo News medical contributor Dr. Uche Blackstock joining me now. Dr. Blackstock, great to have you back on the show. We know that Black Americans have been hit really hard by this virus. Many Black Americans, as we've been saying throughout this show, also don't trust vaccines. Many Black communities still do not get the health care that they need in our country. These are three big problems. What kind of public health messaging would you like to see here around this vaccine? And not just messaging. What do healthcare workers actually need to do to be sure that Black Americans are getting the vaccinations, the information, the proper coronavirus care that they need?
Thank you for having me back, Allison. Yeah, no, these are such important questions to ask. And unfortunately, I feel like we're already months behind. There should have already been an extensive public health campaign directed at Americans and especially Black Americans. I think education is key. I think people are very concerned that this vaccine was developed very quickly. And there are details that they don't really understand, and that needs to be shared as well. They need to understand how vaccines work, and this needs to be done in a very culturally responsive way. I think also vaccines need to be accessible, so we need to make sure that they're not just given out in hospitals and pharmacies, but that churches, community centers, schools, other areas where community members feel comfortable going and are accessible to them, you know, they'll be able to get their vaccines there.
Looking at the trial data that you've seen so far from Pfizer, Moderna, AstraZeneca, are you satisfied with the diversity of the trial participants so far? And if not, who was missing? What do you want to see? What are they doing wrong?
So I know that Moderna had to pause their trials for a little bit to increase diversity. They have about 10% Black participants, a little bit below the U.S. Population for Black Americans. They actually are a little bit overrepresented for Hispanic people. Pfizer is the same. And so, you know, I think that from the very beginning of these trials, they should have been intentional about making sure to recruit Black Americans. I think that's another piece of very powerful messaging, to see that Black people will be well represented in these trials. And then I think that would help decrease vaccine hesitancy in terms of messaging thereafter. So, I think they did as well as they could, considering this short amount of time, but still there's a lot of work that needs to be done to engender that trust.
Dr. Blackstock, there's a COVID study out this week in South Korea. It simulated indoor dining. And in that study, a teen got infected after just 5 minutes of exposure to someone who was 20 feet away. Today, Governor Cuomo announced that indoor dining will shut down in New York City starting Monday. Based on what we know about how COVID spreads and based on studies like this one, do you agree with the governor's call there? And are there things we need to consider or things that we should be doing differently when indoor dining returns in New York City?
Yes, absolutely. I think that we have a lot of evidence now that indoor dining is a key driver of spreading coronavirus infections. I think in that study, especially, there were no windows, there was no ventilation in that restaurant. And so to think about someone 20 feet away from someone else being able to be infected with coronavirus is really incredibly striking. And so this just tells us that indoor dining is dangerous. And right now, while we have cases surging, we'll have to close indoor dining. This is an even more reason why we need to pass that stimulus bill so that we can support small businesses and their workers through this very difficult time, which will likely last the next few months.
There was another pretty scary study out today in the journal Science. This one traced 200 to 300,000 COVID cases back to a conference in February in Boston. Now, this was a conference that had fewer than 200 people, and it caused that kind of COVID spread. I could not believe it when I read this. But you are a medical professional. You may not have been quite as surprised. What does a study like this tell us about super spreader events and gatherings and, oh my goodness, just how careful we need to be?
And actually, the interesting part is when they initially looked at that convention, they thought only 22,000 people had been infected. And now, looking closer, now several 100,000 people have been infected. And I think that what that speaks to is how interconnected we are. Many of those people at this conference traveled internationally. So after the conference, they traveled to various countries, spreading the virus everywhere. So I think that a few lessons to learn, that we are more interconnected than we realize it. Physical distance, incredibly important. And we also need to really probably reduce traveling. Traveling increases the spread of this virus significantly and exponentially. And so over these next few months, we need to call for reduced traveling, even for business or leisure.
Dr. Blackstock, it's always great to see you. Thanks for your expertise, your wisdom, your advice. Have a really nice weekend.
You too, Allison.
Hey everyone, I'm Allison Morris. You are watching NBC News Now. At this hour, the coronavirus pandemic is hitting new highs. For the second day in a row, the U.S. has set new records for COVID cases and deaths. Nearly 230,000 new cases reported yesterday, 3,110 deaths, more than 107,000 people in the hospital with COVID right now. That's according to the COVID Tracking Project. Today, the FDA said it's rapidly working on emergency use authorization for Pfizer's coronavirus vaccine. Health officials expect 20 million people will get a vaccine by the end of the month, with the first doses going to healthcare workers and long-term care centers. But earlier, the HHS Assistant Secretary for Health, Admiral Brett Giroir, said the average American won't be able to get the shot until the spring or summer.
We are very confident by the May-June time period that any American who wants a vaccine will have a vaccine available. So this is going to be extremely rapid. The next group after the first group will probably be other vulnerable individuals, like those who are not in a long-term care facility but elderly, maybe individuals who have a lot of chronic conditions, and probably some critical first-line responders. But then it will rapidly roll out to the rest of the American people.
Let's go now to NBC News correspondent Ellison Barber. She is outside Pfizer's largest manufacturing facility, which is in Portage, Michigan. Ellison, could you walk us through Pfizer's distribution plan?
Yeah, so the U.S. federal government, what has been called Operation Warp Speed, has decided how the vaccines will be allocated in terms of amounts, and they're going to send it to each state based on the state's adult population size. So a state like California is going to get a lot more doses than a smaller state like Wyoming. And then after that, though, once the vaccines are actually in these states and the amount of that, Each state gets to set their own distribution plan. What we know will happen at this plan is that within about 24 hours of the official green light from the FDA, we expect to see trucks start moving here. The vaccines will be put onto those trucks in sub-zero containers, and then they will be taken to FedEx and UPS distribution centers in Memphis and Louisville. From there, FedEx is going to handle distribution for the majority of states west of the Mississippi, and UPS will handle it for the majority of the states to the east. And then again, you get into all these different plans from different states. Here in Michigan, they are expecting about 84,000 doses of the vaccine initially, and they say that they will first distribute it to healthcare workers and people who live in long-term care facilities, which is something that we know almost all states and territories are doing, and that is the process, the initial distribution groups that was recommended by the CDC Advisory Board. Allison?
Ellison, what can you tell us about how many doses hospitals will be getting, and what are healthcare workers advising Americans to do even when this vaccine becomes available?
So a lot of hospitals we've asked that question to, they're not entirely sure. They're sort of waiting and seeing here. They don't know exactly when they will get the vaccine. They expect it to be sometime earlier, middle of next week. And they don't exactly know how much they're going to get. They've asked for certain amounts, but when you ask for a number, they quickly give the caveat of, but that could change, or but we're not entirely sure. I did talk to the Department of Health and Human Services here in Michigan, and all they would say in terms of that question of how much are hospitals getting, when will they get it, was that within the first 2 weeks of the vaccine becoming available and temporarily authorized by the FDA, they expect every hospital and health department in this state to at least have one shipment of the vaccine. Doctors that we have spoken to nationwide, though, they say once this vaccine comes out, and they call this moment groundbreaking, a moment they have been waiting for a very long time, they're urging people to be patient and to not stop wearing their masks just yet. Listen here.
Even as we start to vaccinate people, it's going to be important we continue to do the things that we should be doing, and that is wash our hands, wash our hands, wash our hands. Wear a mask when you're in enclosed environments or when you're going to be exposed to people you don't know where they've been, and stay socially distanced when you can do that.
A big part of plans for every state is making sure that their residents are educated and not only know about the facts around this vaccine, but that also those who get vaccinated know that they need to come back in a couple of weeks, 3 weeks for the Pfizer vaccine, 4 if it's the Moderna vaccine down the road, and get a second dosage. Allison?
All right, Ellison Barber, thank you so much. More than 107,000 people woke up in the hospital today with COVID-19. That is an all-time high, according to the COVID Tracking Project. ICU beds are filling up across the country, but things are especially bad in Texas. The Lone Star State has one of the lowest ICU capacities nationwide, and things there are only getting worse. NBC News correspondent Aaron McLaughlin is in Austin with more.
Hey, Allison, Texas is one of those states with the lowest number of ICU beds available. Here in Austin, all over the Lone Star State and across the country, there's concern. The situation's only getting worse. This morning in Texas, doctors say they're battling a forest fire of infections. Hospital ICUs reaching capacity across the state.
What I'm worried about is that we can't keep up. And in some cases, you may end up denying care to people who aren't likely to make it. That's a real tough one.
In Austin Thursday, Patricia Perez's family held her funeral. The 70-year-old grandmother believed she was infected with COVID while volunteering as a poll worker during the election.
She was so passionate about, working the polls. She just wanted you out there to vote.
When you hear people say that this pandemic is a hoax, what do you have to say to them?
People don't take it seriously until it hits their family.
This crisis is now coast to coast. Since Thanksgiving, 20 states have seen COVID deaths surge by more than 50%. Health experts worry with a hodgepodge of regulations state to state, there's still no uniform response to this crisis.
We are in the time frame now that probably for the next 60 to 90 days, we're going to have more deaths per day than we had in 9/11 or we had in Pearl Harbor.
In Michigan, 6 hospitals have reached capacity this week. In California, ICUs in 10 rural counties have no available beds. The same is true at many city hospitals, like in Silicon Valley and at Providence St. Joseph near Los Angeles. The exhausted staff here say it's personal.
I don't get to see my mom because I'm scared that I might get something from me.
Some hospitals now having to choose between caring for COVID patients and those with other serious health conditions, like Utah mom Lori Terry. In October, her heart suddenly stopped. Doctors say the ICU beds she needed all were filled, many by COVID patients. Lori's family now left heartbroken.
Because she could not access medical care, she died. If one less sick person had been in the hospital that day, she would be here right now.
Here in Texas, we're seeing increases in the numbers of deaths as well as hospitalizations, approaching the numbers we saw over the summer when the crisis was at its peak. And the concern is, as the virus spreads like wildfire across the state, there aren't enough resources to put it out. Allison.
Healthcare workers in Pennsylvania trying to perfect their vaccine distribution strategy before the FDA approves a COVID vaccine. The state doing test runs of mass vaccination drive-thrus. Let's go to NBC News national political reporter Josh Letterman, who's in Media, Pennsylvania, where they've been doing those vaccine test runs. Josh, there was a dress rehearsal there yesterday that you actually took part in. How'd it go?
Well, if you've ever been to a drive-through COVID test site, Allison, or you've gotten a flu shot, this was kind of like a combination of the two, and they really had the system down pretty well, kind of like an assembly line. The first step was registration. They took your info, and in fact, before they even give you the vaccine, they scheduled you for your second dose to try to make sure people come back 3 weeks later to get that second dose that you have to have with both the Pfizer and the Moderna vaccines. And then we watched as a nurse practitioner explained to me what the vaccine does, what some of the potential side effects are, how the immunity works, and answered questions I had. And from that point, it was basically a flu shot. I rolled up my arm sleeve, and there was a little pinch in the arm, and that was basically that. And then they sent me off to a monitoring area. They tested this very closely to see how long it was going to take and found it was taking about 35 to 42 minutes per person. And I spoke to the doctor who set up this site, Dr. Jorge Jimenez, who told me that the reason that it was taking longer than they had expected, in part, was because it was taking them a long time to reassure patients who were concerned about the safety. Take a listen.
I think the most important thing that we're realizing is patient education. I think a lot of people are somewhat concerned. They want to know why this vaccine is good, why it's not, why can it cause complications. So we're going to spend some time on patient education in different areas of the process. For the most part, most people have local reactions like muscle pains, body aches, nausea, and vomiting. So those kind of things are just normal response from the body having the vaccine.
And just in case you do have any of those side effects, Allison, here at this site, they had a paramedic on hand, and for 15 minutes after the fake injection, you had to stay there in a monitoring area. You were supposed to honk your horn 3 times. If you were starting to feel any effects, somebody would come over and make sure you got taken care of.
Josh, I'm assuming since this was just a fake run-through, you didn't have to honk the horn. But a question for you. As you mentioned, the whole process took about 35 minutes or so. Ideally, what time do they want to get that down to? What's their goal?
Well, they're hoping to shave a couple minutes off it, get it closer to half an hour. But interestingly, okay, Allison, more important than how long it takes is making sure that they can time this exactly right. Because remember, once they take these trays of frozen vials of vaccine out of the freezer, they only have 5 days they can use it. So if they take 100 vaccines out, they better know that they've got 100 people lined up that can get shots in arms before that vaccine goes bad.
Josh, as that state is preparing to roll out vaccines, it's also adding some new COVID restrictions starting at midnight. What is shutting down, or what are they cutting back there, and for how long?
Yeah, the state's governor here, Tom Wolf, said he didn't want to have to take these measures. Governor Wolf, in fact, contracted coronavirus just a few days ago himself. And so now, as a result, starting tomorrow here, Allison, indoor dining in the state of Pennsylvania is shut down. Sports for K through 12 students shut down, and limited gatherings are going to be even farther restricted to 10 people or fewer. Allison.
All right, Josh, that was very cool to hear how this might work. Thank you so much for taking us along through the drive-thru.
You got it.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.